Hello everyone, and thank you for joining me today. I am Dr. Kathleen Benton, and I am the President and CEO of Hospice Savannah. I am so proud to sit with you today and walk you through all that we have done in 2020. Because we are not able to come together in our community meeting, we are going to do this a little differently and make sure that everyone is socially distanced and safe, and this will be our annual report for 2020. We began the year with our 2020 renovation. All of the nurses I can recall were in the vending machine area, and that was their nurses' pod. We had to renovate both the East Wing and the West Wing because of structural issues that could not be ignored. We are truly grateful to all of our donors who helped us through this time. I cannot imagine where we would be if we were not able to call on those loyal folks from around the community who were able to help us with the renovation. It was around about the time when everything was draped in construction that COVID hit. We heard of this disease called COVID, and we sat around tables trying to plan hypothetically, only hypothetically, how would we address this? We're a hospice. We don't have a procedure unit. We don't treat much infectious disease. Thus, we don't have a lot of PPE. We had surgical masks, some gloves, and a few gowns. We had to then design a PPE task force when we knew that we had to look COVID in the face and take it on in any way our community needed. COVID came to town in March, and we had our first patients with COVID in March. So we truly greeted this vicious disease at the very beginning of where it sat in our community, and we have followed it up until now. We created a COVID team. We worked with our staff who were just as fearful as the rest of the community, and we knew this would be something that we really had to address in as many ways as the community needed. During 2020, our team of physicians, nurses, nursing assistants, volunteers, social workers, allied therapists, and chaplains have the privilege of caring for 1,114 patients, including babies and young children, helped through our pediatric hospice butterfly team. Despite COVID-19, donor support enabled 139 patients to receive the gift of music through 626 individualized sessions, including some sessions that were a bit non-traditional and innovative. Even with a brief pause at the onset of the pandemic, you helped to give the gift of healing massage to 242 hospice and home care patients during 602 separate sessions. In the midst of all that, we were going through a huge project with a consultant. Multiview Incorporated joined Hospice Savannah. They were here to look at our quality, to look at our documentation, to look at our consistency, to look at the way our workflow and processes went for Hospice Savannah, and to make some major changes that, again, focused on the community and making sure that we are the best of all the hospices in the community. When COVID came to town, we put this on pause for a few months to be able to regroup, take care of patients, and make sure that we kept our staff safe. But we kept rolling. When we needed a staff meeting, we did it in the parking lot. When we need our 170 employees to come together, we did it in sessions of 10 at a time. We taught and discussed and held group meetings and educations 10 at a time, 17 different times if that's what it took to make sure that we came together safely. During 2020, our caregivers needed us more than ever. We found that they were either in post-traumatic stress from having a loved one in a nursing home who they could not see, or they had taken that loved one from a nursing home and taken on the care all by themselves. Either way, they were very stressed, they were very tired, and they needed regular support. Thanks to you, 317 family caregivers were given support and encouragement through our Adele Caregiver Institute. Of those, 200 received individual one-on-one consultations, 101 attended dementia-related workshops, 13 learned hands-on caregiving skills, 117 attended caregiver support groups, and 32 benefited from restorative yoga classes. Although COVID-19 prevented our Memory Keeper volunteers from meeting with our patients, your financial support enabled our Story Keeper to gather life stories from 12 patients through 30 sessions. During this time, the leadership team and myself were working through a court case that came to Hospice Savannah about 2014. Many of you who have been on our board before, during, and now have heard of our ZPIC court case. This was a brutal attempt to scrutinize all the work that Hospice Savannah had done over a period of years. These type audits have in the past taken down nonprofits like Hospice Savannah. We don't have the compliance staff, we don't have the corporate support of other hospices, but we did have the very same scrutiny. The audit in sum total was a $12 million fine for Hospice Savannah. Fortunately, by December of 2020, in the midst of everything, we were able to win this case. We were not fined, and in fact, we received a refund for much of the money that we had paid into the ZPIC since 2014. This was a huge win for Hospice Savannah and really reaffirmed the quality that we truly have in the work that we do. So we will continue with MBI, with our community-focused model and our change in efforts of processing through 2021. We had to pivot in a lot of ways in the way that we treated our community. We did have a COVID team to make sure that we were doing things safely and we were attending to the needs of our own staff who may have immunity issues or struggle with the fear of COVID. However, there's so many other programs that you know about and you're a part of as a community. One of those is our grief counseling. Full Circle Grief and Loss Center continued to provide compassionate care, although for much of the year, both group and individual sessions were held virtually. 120 unique individuals were a part of 725 group sessions offered. The Full Circle team placed over 1,849 phone calls to hospice, family, and friends, and 1,103 phone calls to those in the community, for a total of 2,952 phone calls. In total, 236 unique people participated in one-on-one sessions. 149 sessions were offered to hospice family and friends, while 505 sessions were offered to the community. I'm very proud of the work that Hospice Savannah did in 2020. We found every innovative idea under every nook and cranny, and we made our programs morph and work for the 2020 year. We didn't stop. We never missed a board meeting. We never missed a staff meeting. We never missed a need of a patient in this town, whether they had COVID, they were struggling with grief, or they needed palliative care. Our Steward Center for Palliative Care team helped 2,512 patients at St. Joseph's Candler Hospital Health System in the inpatient setting and 711 in the outpatient clinic to help patients to effectively navigate their medical challenges and achieve a better quality of life through symptom management. Like many other healthcare providers, the palliative care team adapted to provide the right kind of support to patients during the COVID-19 public health emergency. In 2019, the organization piloted the Serious Illness Management Program in the emergency rooms of St. Joseph's Candler's hospitals to provide early palliative intervention to patients presenting in crisis. Early on in the pandemic, the Steward Center made an important pivot and incorporated the serious illness management social workers into the broader palliative care team Together, those social workers with the clinical staff have provided care to over 100 patients and families affected by COVID-19. They have truly come together with all that the hospital has done at St. Joseph's Candler to help the staff and help the patients get through grueling times and highly symptomatic cases. From caregiver, family, patient, hospice, palliative support that we do in this community, we stayed true to everything that Hospice Savannah has stood for since 42 years ago, since 1979, when we came together to meet a community need. Even with the extraordinary challenges posed by the COVID-19 pandemic, we were fortunate to have the assistance of 151 selfless volunteers who contributed 3,136 hours of service in support of all aspects of our organization, including 2,377 hours of home care and 759 hours in the hospice inpatient unit. Especially meaningful during the year of COVID-19 were those volunteers who made custom shutterfly books for patients and one volunteer who created original illustrations for one patient's life review. Additionally, 16 volunteers assisted, donating 586 hours at the Hospice Savannah thrift shop in Pooler. We ended the year with the vaccinations coming to town. We were all elated and excited. We felt that the end was in sight, the light was at the end of the tunnel. This is partially true. What we have found is that the vaccinations gave us another goal that has trickled down to 2021. And our new efforts specific to COVID, now that we have adapted to that new work-life style and balance, is to vaccinate this community. We are meeting the community need to get the community back to where we once were before COVID, and that is by getting as many people as possible vaccinated. We have now partnered with Gulfstream, Savannah Tech, and we are a public mass vaccination site. That site is out by the airport in a beautiful Gulfstream building, and we will continue to vaccinate anywhere between 500 to 1,000 people every week until there is no need for vaccination and we are truly back to the way it was before COVID. Because of your generous support, our foundation allocated $800,572 to ensure the following important uncompensated services could be provided during 2020. $184,299 for Full Circle Grief and Loss, $87,286 for the Edel Caregiver Institute, $158,464 for Stewart Center for Palliative Care, $110,055 for the Healing Arts of Music, Massage, and Storekeeping, $180,268 in indigent care, $80,200 for community education. In closing, what is most important about this entire video is gratitude. We could not have made it through 2020 without our donors, without our volunteers, without our advocates. We needed you for that call of check-in, for the support, for the morale boost that you gave when you said, "What can I do?" You funded some of our staff lunches so we could bring a food truck here and raise our staff morale. You helped us when we needed to create extra education, fund more PPE. You worked with us through the renovation. Our donors were here for 2020 when we needed you more than ever, and we are so grateful for that. Going into 2021, it is time to live again. It is time to see one another. And we hope by the spring you will do some of this for us. Our theme is cause for celebration, cause for being together. We want to see one another on back porches. We want to see you in small groups. We want to see you who are vaccinated and feel safe. We want to come together to tell you about our year, our plans, and to raise awareness, raise money, and get back to more work for this community. We hope the next 40 years will be just as strong as the last 42. We hope it'll be a little less tough and a little more fun than 2020. And we appreciate you making 2020 happen and getting us through it. We did well, and that is all because of you. A very special thank you to our board leadership who helped us to successfully navigate an especially challenging year.